I'm Regina Salvucci, a partner at Cindelaney, a Heidrick & Struggles company. Cindelaney is a culture-shaping firm, and we have been focused on culture for almost 40 years. Our purpose is to positively impact the world by inspiring leaders to create thriving organizational cultures. We work with many different organizations and industries, one of which is healthcare.
We knew that the missing ingredient was our culture, that we really had to address that you can have all the best talent, you can have the best plans, you can have the best strategy, objectives, goals, but without the culture piece being absolutely right, we were not going to achieve the kind of results we needed to achieve. But we really almost missed the fact that culture is the key ingredient. It is the magic, if you will, that makes everything else work.
So what do you see now today as a result of the work that you've done on culture? How have those metrics improved?
Well, on every front, we've seen improvement. So on the associate satisfaction, we're now in the top 5% in the nation. In clinical quality, almost every one of our quality scores is in the top quartile. We've gone from a BBB bond rating to an A+ bond rating with Standard & Poor's and Moody's. Our customer satisfaction or patient satisfaction scores also are achieving top quartile. That's kind of a lagging indicator that our culture work has really been outstanding, and it is translating into patient satisfaction improvement. Well, patient and family-centered care is the centerpiece of this, and it really has been just wonderful to use the Cindelaney tools to achieve a mindset that really embraces not just the patient, but the family in the care of the patient. We're ahead of budget this year. We've exceeded budget on each of the previous 5 years. And as I mentioned before, our bond rating continues to improve. So it is all tied together. As a result of the culture work we have done, that's really what's driven a lot of the volume improvement that we've seen over the past few years. I've been leading people for over 40 years, since I was 22 in the Navy and had 30 people reporting to me. Cindelaney brings to the table the best tools I've ever seen for changing mindset, addressing culture, building teamwork, getting all the fundamentals in the organization right so that the culture can transform and be one that's very healthy and robust.
And because the environment is changing rapidly, it begs for organizations to change very rapidly as well and become much more agile. So when you shape the culture, you can actually shape it in such a way that decisions are made quicker, responses to the environment are much quicker, and the entire organization are moving in one direction. Associate engagement is a measure of how our associates are engaged with our healthcare system. We've gone actually from a 60th percentile in 2010 to 95th percentile in 2014. One is senior leadership commitment. You have to commit to this. There's no cutting corners, quite frankly. You have to truly walk the talk. But being able to sustain it over this how many years speaks to the commitment that we've had and the senior leadership team commitment to making it work. At the end of the day, what you're really trying to do is to create a better environment where physicians enjoy what they do, where associates enjoy the work they do, and our patients get the care that they need. And when you do all of that, isn't that why we're in this business?
And how is the culture work different from the other people initiatives that you're involved with that engages the employees?
Well, you know, culture isn't a program. It's not a flavor of the month. As you know, it's the DNA. It's who you are. It's how you behave when no one's looking. So we really had to say, what are those behaviors that we think are key to our success in driving the best patient care and the best experience in a patient family-centered care way? And that's our culture. Our people initiatives really are a part of that. They help drive and promote it. We operate now more as one company, one system, less siloed thinking. And when we do that, we can provide more consistent quality outcomes at every site than every facility feeling that they have to, if it wasn't invented in their own backyard, it can't be good.
If you were to talk to other human resource executives, what would you tell them about leading the culture?
I can't think of any other work that's more profoundly impactful on what we do in delivering care than this. So whatever an HR person's industry is, if you want your organization to deliver its best, you have got to focus in on the culture, period, end of story.
We started our culture journey a couple years ago in January, very cold month, where we brought about 50 people together. About half the room were physicians. I knew that we were going to go through a massive organizational change because we were going to install an electronic health record, and I knew that if we didn't have the right soil conditions, the culture to accomplish that, that we were going to install the system, but it would be a big failure. As we went through the Slanton-Delaney exercise, the culture shaping work, I saw a change in the physician involvement, the physician commitment to the success of what we were trying to accomplish. They owned it in a way in which I would have never expected. We realized that the only way we're going to be at our best is if we have a very healthy working relationship between the provider community, the administration, and all the other employees. That was just key, and has set us up for success in ways I would have never imagined. We're all accountable, and we really have to look at ourselves as accountable and not be blaming, and really take a personal stock in what's my role in this. And this culture work can only make that even better than we are today. So I would say to any children's hospital CEO, it's a really important opportunity for you to, really face what I would consider are going to be some of the biggest challenges we've ever had in our professional careers.
We embarked on the journey with Slanton-Delaney to really kind of transform the culture. Although the bedside culture is something that I thought was the best. The teamwork at the bedside was phenomenal between physicians, nurses, therapists, and so forth. And we didn't want to touch that, but everybody else around us, around the team, was important. They all gathered and said, we need to kind of look at ourselves and say, now that we're going to reach out to different communities, this whole new notion of service to our communities was a priority that we needed to embark on. So that's why we started the journey. It's quite fascinating to begin walking through the institution and having employees come to you and say to you that I just went through training and it was the greatest experience that I've ever had in my work environment. The one experience that I think I was most proud of is when we were going through magnet designation, and they call you at the end of the survey about 2 months later to announce whether or not you're designated. They get on a conference line, and we must have had 350 people in this room listening in. And this surveyor basically said, you passed, and there's a big cheer. But she went on to tell us that she has never been in an institution that actually exceeded the standards of Magnet, and she attributed it to the culture of the organization.